Welcome to this video on the Suboxone dental litigation dossier. We will explore the intersection of clinical chemistry, patient safety, and the active multi-district litigation 3092 regarding the buprenorphine and naloxone transmucosal film and its link to unintended dental adverse events. While Suboxone is a life-saving medication used for opioid use disorder, its long-term use has been linked to severe, rapid dental deterioration. Patients, even those with previously healthy teeth, have reported significant decay, often requiring extensive extractions and reconstructive surgery. The dental damage is attributed to a dual-threat environment. First, the film is highly acidic with a pH of around 3.0. Second, the medication causes xerostomia, or dry mouth, which reduces the saliva needed to buffer this acid, leaving teeth defenseless against decay. Data from the FDA's Adverse Event Reporting System highlights the scale of this issue. As of January 2022, 305 severe dental cases were linked to the film, with significant numbers of patients requiring tooth extractions, despite having no prior history of dental problems. The regulatory timeline shows a decade of usage before significant action. Following reports of enamel erosion, the FDA issued a safety communication in early 2022 and eventually mandated an official warning label on June 17, 2022, regarding dental risks. This crisis has led to multi-district litigation 3092. Thousands of individual claims from across the country have been consolidated in the Northern District of Ohio to streamline legal proceedings, with projections suggesting the case count could reach 11,000 by 2025. The litigation centers on competing arguments. Plaintiffs allege a failure to warn of known risks and criticize the acidic formulation. Defendants argue that FDA regulations limited their ability to change labels earlier and maintain that the life-saving benefits of the medication outweigh the dental risks. To manage the high volume of claims, the court uses a, quote, bellwether process. This funnel approach filters thousands of consolidated cases down to a small group for in-depth discovery and early trials, which will help test legal arguments and guide potential settlement outcomes. A critical timeline for plaintiffs is the 3-year window following the June 2022 FDA mandate. In many states, this date triggers the statute of limitations, meaning patients must file their claims by June 17, 2025 to avoid being permanently barred from seeking compensation. Patients are now advised to follow a strict protocol to mitigate risk, including a 15-minute buffer before dosing, proper placement, allowing the film to dissolve completely without swallowing, and waiting at least 1 hour after dosing before brushing their teeth. Addressing this issue requires a collaborative approach between prescribers, dentists, and patients. By integrating careful oral health assessments, preventative care plans, and patient diligence, it is possible to continue life-saving treatment while protecting the patient's dental health.